Kobe, wake up, it's time to go. We gotta get up for school. Let's go, I can't be late. So I worked in the ER for 13 years, and then I had my son, and he was about 3 years old, and it was becoming a lot, working every other weekend, 12-hour shifts. And I decided to go to a different department where I'm able to have a better work-life balance, still take care of acutely ill patients, critical care. I'm able to drop him off at school. My first case typically starts between 8 or 9 a.m. I grew up in this community. My mother worked at a hospital serving this community for over 42 years. So I grew up going to work with her and seeing her help and treat patients. It was very inspiring to see her lovingly, caringly, selflessly give to patients the same way she does at home.
Kellye is the fourth of 5 children. She would look at anything we would show, even in x-ray, if someone was gashed open, she's looking. And I'm like, that's not upsetting you. And my other daughter is by the trash can.
She's humble in what she does, but she's definitely a leader. She knows what she wants and will drive forward.
Cath Lab came up, and it is a department where I have more work hour stability, more time at home, but I'm still able to care for critically ill patients. It's where we're saving lives and cheating death. And that's really what we do in the Cath Lab. We do amazing things.
Cath Lab is sort of one of our core tools in cardiology that for the last several decades and has really advanced over time. But it serves 2 really important roles for us. One is as a diagnostic tool. And so what we can do in the Cath Lab is it gives us a way to very minimally invasively look directly at the arteries of the heart to see if there's any issues with blockages that could be causing symptoms or could even lead to a heart attack or be the culprit of a heart attack. The other side of the Cath Lab, which you'll see as we progress hopefully in the future, will be the therapeutic aspect. And that's where we can actually do interventions inside the arteries of the heart to open them up and allow blood flow to resume after someone has had a heart attack, which may have blocked an artery.
Martin Luther King is in the heart of some people like to say medically underserved, but I think sometimes like the healthcare system willfully neglects populations like this. And this is a population that is unfortunately very sick. We have an extremely high number of patients, for example, that have something called peripheral artery disease, where because they've had diabetes that hasn't been treated so long, the blood flow that's supposed to give their legs enough blood flow to walk and do things isn't enough to heal their legs. We're in a neighborhood where a lot of people that are really young, like 50s, 60s, are getting limbs amputated because the blood flow that's going there isn't good enough to maintain their limbs alive. And so having a resource like I like to call it an angio suite, some people call it a Cath Lab, having that is life-changing for patients.
So contrast is going through all these arteries and they branch out, right? We're looking for the blemish, we're looking for the bleeds. So we're looking for the
being able to give the patients exactly what they deserve, which is the highest level of care we can provide, is like critically important to the mission of this hospital.
Before the Cath Lab was here at MLK, sometimes the patients will have to wait in the ER to be transferred and they're actively bleeding. Now that we have a Cath Lab, they no longer have to be transferred. We're able to do the intervention and treat them in a timely manner and save their life.
It's a tremendous deal. Before this suite opened, there were some procedures we just simply could not do. Their only option might be to go to big open surgery, which can take weeks to recover from.
We're able to diagnose these patients and treat them, and they don't have to stay in the hospital for longer extended stays. So now he's just putting the closure device. The procedure is technically complete at this point. A lot of times after we do these procedures, if everything is normal, the patient's able to be discharged the same day.
It's monumental for the patients to have the same level of care that a patient who might be going to Westwood would have.
Now that my son is a little older and more involved in sports, and just knowing how fast time goes and the kids grow up so fast, that I'm able to be hands-on there at all his sporting events, help at practice sometimes when they need it.
You gotta make sure you staying low and putting your leg in front of me. Get big.
I'm able to give back to him and be a mother after working a full shift.
She knows what she can do in this hospital.
And she's a fighter. So she'll fight for the patients, she'll fight for the employees, and she'll fight for the community. She's a fighter.
If you need something done or you need someone to figure something out, Kellye is a go-to person. And that kind of spirit and that, grit and determination is really what kind of helped launch this project.
This hospital is definitely a beacon of hope for this community in multiple ways. And it's just an honor and privilege to be a part of this hospital to give back to the community that's greatly needed.